Good morning, class. Our topic for today is all about drug education. So, before we proceed, I'll discuss first the learning objectives. So, at the end of the lesson, the students should be able to define and categorize different types of drugs, for example, stimulants, depressants, and hallucinogens. Second, encourage positive peer influence by understanding how friends can support each other in resisting drugs. And lastly, practice techniques for resisting peer pressure in a role-playing activity. So what is drug education? Drug education is also known as substance education or drug prevention education. It refers to the systematic instruction or training aimed at providing individuals with information, guidelines, and resources related to psychoactive substances and their effects. So this education aims to help individuals make informed decisions about drug use and potential risks, as well as promote healthy choices and prevent substance misuse. So, what is drugs? Drugs is any substance other than food that is used to prevent, diagnose, treat, or relieve symptoms of a disease or abnormal condition. Drugs can also affect how the brain and the rest of the body work and cause changes in mood, awareness, thoughts, feelings, or behavior. So drugs have a different types. Its three types of drugs are stimulants, depressants, and hallucinogens. Stimulants are a class of drugs that increase alertness. They are used for various purposes such as enhancing attention, motivation, cognition, mood, and physical performance. It can increase heart rate, alertness, and aggression. And there were examples of stimulants. For example, caffeine, nicotine, amphetamines, cocaine, and methamphetamine. So, what is caffeine? Caffeine is a naturally occurring stimulant found in coffee, tea, chocolate, and other plants. It acts on the central nervous system or CNS. It can it can increase alertness and energy levels. Next, nicotine. Nicotine is a highly addictive stimulant found in tobacco products. It stimulates the release of various neurotransmitters, leading to increased alertness, improved mood, and reduced appetite. But it also carries significant health risks. Next, the amphetamines. It is a class of stimulant drugs that increase activity in the central nervous system. They increase dopamine and norepinephrine levels in the brain, leading to increased focus, energy, and wakefulness. However, misuse can lead to serious side effects and addiction. Next, caffeine. Caffeine is a powerful and highly addictive stimulant derived from the coca plant. It blocks the uptake of dopamine, leading to intense feelings of euphoria, increased energy, and heightened alertness. Cocaine's effects are rapid and intense, but also carry a high risk of overdose and serious health consequences. The next one, or the last one of the examples of stimulant is methamphetamine. Methamphetamine is a potent, highly addictive stimulant drug closely related to amphetamine. It causes a powerful release of dopamine, resulting in intense euphoria and stimulation. Methamphetamine is known for its severe long-term effects on the brain and body, and its high potential for abuse and addiction. Next is the depressants. Depressants is also known as nervous system depressants or colloquially known as downers. These are the drugs that lower neurotransmission levels, decrease the electrical activity of brain cells, or reduce arousal or stimulation in various areas of the brain. It can slow brain function, drowsiness, and impaired coordination. Its examples are alcohol, benzodiazepines, and barbiturates and opioids. So, alcohol is a widely used depressant affecting multiple neurotransmitter systems. Its effects range from mild relaxation and disinhibition to impaired coordination, slowed reflexes, cognitive impairment, and even coma or death in cases of overdose. Long-term alcohol abuse can lead to serious health problems, including liver damage and addiction. Next, benzodiazepines. This is the prescription drugs primarily used to treat anxiety, insomnia, and seizures. They enhance the effects of GABA, an inhibitory neurotransmitter reducing CNS activity. Effects include relaxation, drowsiness, and reduced anxiety. However, they are highly addictive and can cause dependence and withdrawal symptoms with long-term use. Next is barbiturates. Barbiturates are another class of CNS depressants historically used as sedatives, hypnotics, and anesthetics. They also increase GABA activity. They were widely used in the past but are less common now due to their high risk of addiction, overdose, and respiratory depression. Even low doses can cause drowsiness and impaired coordination. Lastly is the opioids, including morphine, codeine, oxycodone, and heroin, are powerful in pain relievers that act on opioid receptors in the brain and body. They produce analgesia, or the pain relief, euphoria, and sedation. Opioids are highly addictive and overdose can cause respiratory depression leading to death. And these are the examples of depressants. Lastly, the hallucinogens, also known as psychedelics, entheogens, or historically as psychotomimetics. These are a large and diverse class of psychoactive drugs that can produce altered states of consciousness, characterized by major alterations in thought, mood, and perception, as well as other changes. It can alter perceptions, confusion, and hallucinations. Examples are LSD, or lysergic acid diethylamide, psilocybin mushrooms, MDA or ecstasy or molly, or the PCP or pencyclidine. So LSD is a potent synthetic psychedelic drug. It primarily affects serotonin receptors in the brain, leading to a range of effects including visual and auditory hallucinations, altered perceptions of time and space, intensified emotions, and changes in thought processes. The effects typically last 8 to 12 hours and can vary widely depending on the dose and individual factors. LSD is illegal in most countries. Next is psilocybin. These are a group of fungi containing psilocybin and psilocin, which are psychoactive compounds. These mushrooms have a long history of use in various cultures for spiritual and religious purposes. Ingesting them produce effects similar to LSD, including hallucinations, altered perceptions, and emotional changes. The duration of effects is typically 4 to 6 hours. The legality of psilocybin mushrooms varies widely across jurisdiction, with some regions exploring their potential therapeutic uses. Next is the MDMA, also known as ecstasy or Molly. This is a synthetic drug that acts as both a stimulant and a hallucinogen. It increases the release of serotonin, dopamine, and norepinephrine, leading to feelings of euphoria, increased energy, empathy, and altered sensory perception. It also carries risks of overheating, dehydration, and cardiovascular problems. The effects typically last 3 to 6 hours. MDMA is illegal in most countries, like LSD. Lastly, the PCP, also known as angel dust. This is this dissociative anesthetic. It disrupts the normal functioning of the brain, leading to feelings of detachment from reality, hallucinations, distorted perceptions, and unpredictable behavior, including aggression and violence. It can also cause severe cognitive impairment. The effects can last several hours. And these are the examples of hallucinogens. So for your important notes, using any of these substances carries significant risks, and their effects can vary greatly depending on individual factors, dose, and context. Misuse can lead to serious health consequences, addiction, and even death. If you or someone you know is struggling with substance use, seek professional help. And for your activity, create a drug impact chart. And for your assignment, research a local or national drug prevention program and prepare a brief report on how the program helps individuals resist drug use. Second is include information such as the types of activities the program offers, who runs it, and the main message it promotes. So that's all for today, class. I hope you learned something from our topic. That's all. Thanks for listening.